Okay, so I am just coming to you hot off the press here, a little bit pissed off at my own medical bills. And actually, in reference to the medical bills for my 2-year-old son. So, background, because I just know that other people are dealing with these same ridiculous costs of services. The hospital just essentially billing a lot of the time whatever they want, sometimes things they didn't even do, which makes it very important that you monitor and follow your bills over time. And the sad reality is that you have to take time out of your day to fight these things and not to just get bounced between your insurance company and the hospital billing department back to the insurance company. Let me just tell you a little bit about what's got me so fired up right now.
Somebody get this guy some help!
So, back in June, my son had a lingering cough. He started to look a little bit more sick, and so we ended up taking him to the outpatient office. And at his outpatient pediatrician's office, his charges for that visit were, drum roll please, they were billed at $453. Now, insurance covered about $284 of that, leaving a balance of about $169, $170. Okay, I'm not crazy about that. Hospital visits are broken down into low complexity, medium complexity, high complexity, and they are billed that way. So this is a high complexity visit, which costs a little bit more than a medium or moderate complexity visit, which costs more than a low complexity. So that's one charge, right? Same day, we are told to go to the ER because there's a concern that he may have a pneumonia. And so we go to the ER. Well, now I have 3 additional bills from the ER, 3 separate bills, not 3 total services. The first bill is emergency visit, physician services. The total billed is $381. The CPT code for the emergency department visit is a moderate complexity, 99284. Now, my insurance company paid $364 almost of this, leaving $17 left. Whatever, I'll pay $17, absolutely. On top of the $1,100 that my $1,200 that my family pays in premiums every month. Okay, so now also on the same date of service, RAD general visit or radiology general visit, billed $35, insurance covered $16. This $35 is for a radiologic exam, chest 2-view, a 2-view x-ray, a very basic imaging. $35, insurance covers $16. No problem there. What are you so upset about? Well, the last bill is same date of service, emergency visit. A total billed of $4,919.51. Mind you, we went from the outpatient office into the hospital, into the ER, just the ER, and we're there for maybe 3 hours total. Maybe 3 hours with a very, very basic workup. Walked away with over $4,900 billed to us. And insurance covers about $2,600 of that. That leaves us with a bill from this ER visit of $2,300, not including the outpatient visit before we went to the ER. Not including those secondary, minimal charges associated with the same ER visit. But now let me break it down to you. So the first charge is titled emergency room. It is ER level 4, which is indicating a moderate degree of complexity. It is the same CPT code of 99284 but now it's under a different provider, a physician assistant, by the way, that apparently is not covered under physician services. So this emergency room part of this $4,900 plus is $1,600 using the exact same CPT code that I was charged the exact same date of visit, but apparently is unique in that it covers physician services. Now, my son did not see a physician the entire time that he was in the ER. Yet they're saying that the physicians, I guess, working behind the scenes, that somehow between the room that we were in for 3 hours and these nebulous physicians hanging in the behind the curtains of the ER costs us $1,600. That CPT code of 99284, in total, they're charging $2,000 for it. But it gets better. There's a lot of money not covered yet. You have several laboratory charges. The laboratory charges by the hospital are about $2,700. This is for a kid who has obvious congestion, who we wanted to rule out whether or not he had a pneumonia and something that needed to be treated with an antibiotic. And in the ER, the same things that would have costed a tenth of the price as an outpatient visit, when they are done in the ER, we are talking about a probe to check for a bunch of different potential respiratory pathogens. This is a swab that is done in the ER. A probe is stuck up the nose to get a respiratory sample from the nasopharynx, and we are getting a charge for chlamydia pneumonia probe, $623. Now, I looked up the CPT charge for that, $35. Okay? We've got a mycoplasma probe, $623. Again, the CPT code charge associated with that, $35. Both of those are 20x what they would naturally be reimbursed for it. So they're charging 20 times more to me individually as the guarantor for my son than what the government would pay out with government insurance for that same charge. We've got Bordetella pertussis PCR test, $471. The CPT code charge for that is $66. And then we have an infectious agents, these other parts of this respiratory panel that hard to find a charge on that, but we're being billed $921. Now here's the best part, and it's this is where ridiculousness comes in. This is where hospitals don't give a damn what they bill you. They only care that you pay it, and then if you come back and say, hey, this isn't right, they may or may not listen to you. On this one, they damn well better listen, because they charge for specimen collection venipuncture. We specifically asked them to not get any blood drawn because we did not want our young son to be terrified of going into the hospital. And they charged us $50 for somebody collecting blood that was never collected. Not to mention that we got charged $60 for Zofran, for an administration of Zofran, which on Danzatron Zofran, maybe $3, maybe. But we're talking about one dispense. In my personal favorite, backstory on this one, when I did my surgery rotations, I had this wonderful little surgical rotation guideline book that was very succinct, and part of it was emphasizing that we need to take into account what our patients have to pay for things, especially in terms of imaging. And what kind of information is that going to get for us? Now, an MRI is the most costly. And in that book, which is definitely outdated at this point, don't get me wrong, but in that book, it made a very easy to remember cost table for different imaging. MRI, most expensive, they said $1,500. I'd say you could very, very easily kind of double that for today's charges. CT scan, a little bit less specific. You don't see as much or as well with a CT scan. $150. Again, we could double that, $300. Make up for inflation over the last 10 years or so, make up for this just crazy inflation in healthcare. And then you have an X-ray. The recommendation is always, if an X-ray can tell you what you need, don't go and get an MRI, don't go and get a CT, because then you're costing the patient, loads of money. Their insurance may not even cover it. When you could have gotten the same information gleaned from an X-ray. X-ray, $15. We'll say $30. Okay, fine. The chest X-ray that was done for my son in the hospital, not including the separate bill for the radiology general visit and services, the same CPT code billed twice, one for the physician services, one for the physician assistant in the hospital. This 71046, when it's billed by the physician services, it's $35. When it is billed by the hospital services, $574. That's about 20 times more than what a chest X-ray should cost. This shit is crazy. It is already out of hand. It's getting more out of hand, and we are the ones who are sitting here with these bills. We are the ones spending hours trying to negotiate some sort of reasonable price. We are the ones who are sitting outside of the ER with our sick kid, unfortunately having to think about whether or not walking into that ER and pursuing a medical workup for our sick kid, if we're going to be able to afford it. There's no place for that in a healthcare system. It's immoral. It's unethical. It's not right. This is ridiculous to get, in total, all encompassing what was billed on this one day for this one problem, which again turned out to be somewhat mild. And I mean that in terms of he was not admitted to the hospital. He didn't need to be admitted to the hospital. It wasn't that serious. We're talking about $5,500. Now, I'm sure that some other people listening to this have better stories than that, and I would love to hear them, because I really do think that putting pressure on these systems from patients, from the people who are being most affected by it, putting pressure on our politicians to do something about this is the only way through this mess. The hospital can bill whatever they want. There are not regulations, and people don't realize that. They can bill you whatever they want to bill you. And again, it's overpromise and underdeliver. This is my rant of the day, and it's meant to go with a YouTube reposting of a previous series that I did with Taylor Beckman on just the state of healthcare and how corporate healthcare is really destroying not just our healthcare system, but it's destroying Americans' health. You can see that pretty clear in the numbers. I'm talking about life expectancy. I'm talking about maternal morbidity in childbirth in the U.S. versus other first world countries. Look at any of these major outcomes. The United States is in a very piss poor position. So take what you will from it. I just wanted to get on here and have some sort of outlet and give other people an outlet for talking about how frustrating these things are. I mean, you just want to get a modest degree of reassurance and certainty from the healthcare system that your kid's okay, that your family member's okay, that you're okay. And you know, the billing numbers are just insane. They're insane. How can I be charged twice for the same CPT code at the same hospital, seeing one provider, and then be charged twice for the same CPT code for the same x-ray, one for hospital services and one for physician services? If I walk into Walgreens, do I have to pay for them to keep their lights on? Do I have to pay for their employees? Or is that built into the cost of the services? Why do I have to pay for the physician that's employed by the hospital? Why do I have to pay for the room, $1,600 to spend 3 hours in a room, on top of all the other money that I'm paying the hospital, on top of paying 20 times or more for certain services? This shit's really getting out of hand. So help me in doing something about it. Please help me in doing something about it. I don't know what else to do other than spout this on the airwaves and try to gain traction for this channel so that I can spread these messages more to a more widespread audience, so that maybe we as a group can get some change made in how our system operates. As always, like, subscribe. Thanks for listening. All that good stuff. Yeah. Namaste. Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe. Do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.